Hey there, health enthusiasts. Welcome back to our channel Total Vigor, the go-to place for all things wellness. Now, we all know the saying, an ounce of prevention is worth a pound of cure. Well, when it comes to our gums, that saying couldn't be more accurate. In this video, we'll explore the world's worst dental disease, periodontitis, and why it's often referred to as the silent destroyer of smiles, and most importantly, how we can take proactive steps to prevent it. Periodontitis is no joke, and understanding its impact is the first step in protecting our oral health. So let's get informed and empowered. Are you ready? Let's tackle the world's worst dental disease, periodontitis. Dental illnesses impact millions of people globally. Among these, periodontitis is one of the most serious and harmful disorders. If left untreated, periodontitis, a progressive inflammatory condition that damages the tissues that support teeth, can cause irreversible harm. This video explains why periodontitis is regarded as the world's worst dental disease by examining its causes, symptoms, effects, and preventive strategies. The incidence of periodontitis. To create focused public health interventions, it is essential to comprehend the prevalence and distribution of periodontitis. According to epidemiological research, periodontitis affects people of all ages and demographic backgrounds worldwide. With an estimated frequency of 10.8% worldwide, severe periodontitis is the 11th most common disease, according to the World Health Organization, WHO. Periodontitis is more common in some populations than others. Age, gender, and socioeconomic level are important risk factors. Due to the long-term cumulative exposure to risk factors, studies have shown that the prevalence of periodontitis tends to increase significantly in individuals aged 65 and older. In addition, it has been discovered that men are more likely than women to be at risk, and those with lower socioeconomic position may encounter difficulties getting dental care, influencing the frequency of periodontitis in these groups. Periodontitis causes gingivitis, an inflammation of the gums brought on by plaque buildup, a bacterial biofilm that develops on teeth, usually precedes periodontitis. Common risk factors for the development of periodontitis include genetic predisposition, smoking, poor dental hygiene, and diabetes. The bacteria that cause plaques secrete toxins that set off an immunological reaction that eventually destroys the tissues around them, including the alveolar bone, periodontal ligament, and gums. Signs of periodontal disease. Periodontitis is a silent but deadly disease, especially in its early stages when there may be no symptoms. The symptoms grow more noticeable as it goes on. The classic symptoms of periodontitis include loose teeth, pockets forming between teeth and gums, swollen and bleeding gums, and receding gums. These signs point to the urgent need for expert intervention since they demonstrate the continued degradation of the periodontal tissues. The after effects of periodontitis. If left untreated, periodontitis can have serious repercussions that go beyond the mouth. As the condition worsens, the alveolar bone is destroyed, which affects tooth stability and eventually results in tooth loss. Furthermore, there is a connection between the persistent inflammation brought on by periodontitis and systemic health concerns like diabetes, cardiovascular disease, and respiratory disorders. The oral cavity's bacterial dispersion and subsequent inflammation can exacerbate pre-existing medical disorders by adding to the body's total inflammatory load. Effect on life quality. The patient's quality of life is significantly impacted in addition to the physical effects of periodontitis. Losing teeth can interfere with speaking, chewing, and facial appearance, which can cause psychological anguish and low self-esteem. Furthermore, the persistent pain and suffering brought on by periodontitis can seriously impair a person's general well-being, interfering with day-to-day activities and social contacts. Preventive actions. Taking a proactive stance toward your dental health is essential to preventing periodontitis. Maintaining good oral hygiene habits, such as brushing, flossing, and getting regular checkups, is essential to reducing plaque accumulation and stopping gingivitis from developing into periodontitis. A key factor in lowering the risk of periodontitis is changing one's lifestyle. Examples of these changes include quitting smoking and controlling underlying medical disorders like diabetes. Promoting a culture of prevention requires educating people about the value of good oral hygiene and routine dental checkups. Therapy approaches. Timely intervention is crucial to prevent further damage once periodontitis has established itself. The goal of professional dental procedures like scaling and root planing is to get rid of tartar and plaque beneath the gum line. In more severe situations, surgery can be required to treat gum tissue repositioning, regenerate missing bone, or treat deep-seated pockets. It is possible to give antibiotics to treat bacterial infections. However, early detection and the patient's dedication to continuing appropriate oral hygiene practices are critical to the treatment's effectiveness. Novelties in periodontal science and therapy. The study of periodontology is a constantly changing topic, with research efforts concentrated on developing new methods for diagnosis, treatment, and prophylaxis. More accurate assessment of periodontal diseases is made possible by advanced imaging techniques including molecular diagnostics and cone beam computed tomography, CBCT, which enables early detection and treatments. To improve the results of periodontal therapy, novel therapeutic approaches like as targeted antibacterial medicines and regenerative therapies are being investigated. The goal of regenerative treatments is to facilitate the regeneration of missing bone and the reattachment of connective tissue in order to restore damaged periodontal tissues. Furthermore, periodontal treatment is seeing a rise in the use of tailored medication. The creation of individualized treatment programs can be aided by genetic testing and biomarker analysis, which can offer insightful information about a person's vulnerability to periodontitis. This strategy has the potential to maximize treatment results and enhance long-term dental health. In conclusion, because of its subtle symptoms, dire repercussions, and influence on general health and well-being, periodontitis stands out as the worst dental illness. In order to tackle this terrible ailment, prevention via education, lifestyle adjustments, and regular dental treatment is essential. The maintenance of systemic and oral health as well as effective treatment depend on early detection and action. As the intricacies of periodontitis continue to emerge, we must work together to provide access to dental care, encourage preventive measures, and increase public knowledge in order to reduce the disease's destructive impacts as much as possible. And there you have it, folks. We hope you found this video helpful and useful for everyday life. Our aim is to provide you with insightful information about everything health through our channel. If you enjoyed this video and want more tips on healthy living, don't forget to hit that subscribe button below. And for our next video, we'll be exploring a very unique topic, body positivity for men. Before you go, we want to express our gratitude for your time and support. Your comments and likes mean the world to us. Remember, a healthier you starts with small, consistent choices. Thanks again for watching. And until next time, stay healthy, stay happy. Bye.